Okay. Hello and welcome to this amazing webinar with Samir Rawal from Tata Consultancy Services, Digital Impact Square, Mumbai. We also have with us Namrata More, a very upcoming innovator from the Google Development Circle. Our honored guest, Samir Rawal.
Hello and welcome to this amazing webinar with Samir Rawal
Samir,
from
I think you'll have to
Tata
mute.
Consultancy Services, Digital Impact Square, Mumbai. We also have with us Namrata More, a very upcoming innovator from the Google Development Circle. Our honored guest.
And today, it's a very crucial time in India. India is in a national emergency and people are looking for oxygen concentrators. They're looking for food, supplies. People are on the streets without care and they're dying. This is not a pandemic which we have ever witnessed in our lifetimes. There was something like this, the Spanish influenza several decades ago in the 1900s, but there were military hospitals. Every street was made a care facility. Imagine every street we ever walked on, we danced, we laughed. It has become an emergency care center. So India is like that today, and it is no joke. So what kind of soldiers do we need today? What kind of people do we need today to come and take control of the situation to enable services? I met Samir Rawal for the first time in 2017 at Digital Impact Square in Nashik. This is a facility which was incubating a lot of youngsters who had not even graduated. They were people who had come out of corporations and they wanted to serve the country. They wanted to serve the community. And Samir Rawal was heading this initiative under the guidance of MIT Media Lab, a lot of governments, corporate partnerships, Tata Consultancy services, and he had one mission. He wanted to serve the community. He had said no to a lot of big opportunities, and his main aim was to enable innovators and students and all sorts of talented people to come and build something sizable, whether it's a startup, whatever you may call it, to come in and build something very sizable and deploy it at scale. So where did Samir Rawal start his journey? At Kumbh Mela in 2015, a very fascinating journey where a Kumbh Mela was made completely high tech. And Samir has lived through this journey all the way from need finding to ideation to deployment of solution to 30 million pop-up city. Imagine your small town with a few thousand people starts hosting 30 million people. What kind of planning and deployment will you need? And Samir has lived that journey. Today, India faces the same crisis. Suddenly, there is an exponential increase in the need for oxygen concentrators, hospital beds, care facilities, mental health services, food, and name it, transportation, emergency ICUs. So all of this is being enabled by different people, and people like Samir are the brains behind such operations. So Samir is totally focused on startups, and he has made many startups successful during the pandemic, and they are out there deploying solutions. So let's have a close heart out chat with Samir Rawal. And without further ado, Samir, welcome to the session.
Thank you, Vidya, and good evening, good morning to all of you who are joining in from wherever you are in the world.
So Samir, would you like to start off with your journey with Kumbh Mela 2015, and how did you come to become a social innovator at Digital Impact Square? I met you there for the first time, and I knew you were guiding students at various levels. They were building different products. They were stuck in different challenges. Some of them were, academic papers, and other people were building burning problems. People were building street cards. I remember it was a very what do you call? It was a melting pot of lot of things happening. So tell me a little bit what happened in Kumbh Mela 2015. What was your role, and how did you come to start guiding startups in Digital Impact Square TCS today?
Sure. So first of all, I would like to clarify. I think you said a lot of nice things about me, but it was and still is a group effort. There are a lot of people involved in this. Just as I'm a mentor to many startups. I have my own mentors who are guiding me and my entire team at Digital Impact Square in this journey. And I think at some levels, what we are seeing now, and from the outside world, it does seem quite terrible. I think it's always bad news travels way faster than good news. But there are a lot of people at the grassroots level on the ground who are dedicating their lives in trying to save lives of others, improve lives, enhance lives, create a positive impact in the lives of others. And what often happens is many of these stories never make it to the day because these are all positive stories, and unfortunately we always hear about negative stories, right? So before we begin to look at what's happening now, I have a small presentation. I could walk you through our journey, which started at the Kumbh Mela, and how some of the elements that we saw back then are still as relevant even in the current pandemic, and how some of our learnings that we have gone through over the last 3-4 years, working in the social sector, trying to solve very complex challenges, wicked problems as they're called, and see if we can kind of guide any aspiring or existing startup that's looking to try to create an impact or serve the country, or in their own little way try to make a difference. What are some of the things that they can keep in mind, or what are some of the things that they can learn from our journey that they could apply to their journey as well? So just give me a moment. Let me open this presentation. Please confirm once you're able to see it. Are you able to view my screen? Okay. Am I audible? I hope I'm loud enough. Okay.
Yes.
So let me project this. Okay. So innovation in the time of crisis. So what can startups do? I think this was essentially what we discussed as an interesting topic, as a relevant topic. More than interesting, it's quite relevant at this point of time. And let me start by first, a very famous quote by Albert Einstein, who said that in the midst of every crisis lies great opportunity, right? So you always have the opportunity to look at crisis as a glass half empty, which is look at all the problems and how nobody's doing anything about it. And everybody is failing at doing it and people are losing lives. But you could also look at it as a glass half full. This is basically understanding what are the challenges and how can I, as an individual, or how can we as an organization look towards addressing some of those challenges. Can I solve everything? Probably not. Will I be able to solve everything on my own? Probably, definitely not. But at least if I don't make a start, I will never know what I'm able to achieve. So in the midst of every crisis lies great opportunity. And this is an opportunity for a lot of people to really start thinking about impact. And a lot of people are doing that on the ground as well. So let's rewind back about 5 years back, 6 years back, for the Nashik Kumbh Mela. So Nashik, as many of you may be aware, but just to let you know, it's a small city about 3 hours north of Mumbai, and it hosts the Kumbh Mela. Kumbh Mela is the largest human gathering on the planet, every 12 years, right? So this is a religious event that occurs once in 12 years in 4 cities across India, Nashik being one of them. Now, in 2015, the population of Nashik was about 1.5 million people. And the number of visitors that were expected to come to the city was 30 million. So imagine if you are staying in a house, right? And the house can accommodate maybe 4 people, 5 people, and you suddenly have about 100 guests who come in. What can you expect? What do you expect? Chaos, right? And that is essentially what used to happen prior to 2015. So Nashik is an ancient heritage city with narrow bylanes. It's a very small city for those who have visited it. There were, in every the Kumbh Mela preceding the 2015, there were typical challenges that came up when a large influx of visitors descend upon a very small place, right? So you had epidemic situations. So typhoid, malaria, conjunctivitis, basically of the eyes, waterborne diseases, airborne diseases, vector disease. Every Kumbh Mela would end up, and because this was held typically in the months of July and August, when it is monsoon, there were a lot of waterborne diseases that would erupt, and it was very difficult to control. There were stampedes, for example. So in 2003, which is 12 years prior to 2015, more than 30 people died in a stampede that happened at the railway station, right? All of these were avoidable losses. There is a significant strain on infrastructure, right? So it is basically a challenge of humongous proportions. So if you take Nashik as a sandbox of India, right? And the Kumbh Mela as a major event where there is a significant strain on the resources that the city has, it starts giving us an idea of the sense that the pandemic is putting up on us at this point of time, and especially when it comes to what I would say as, there is a resources strain. So there's a lot of resource strain that's happening in our country right now, especially in the healthcare sector, right? And it is at this point of time, right, that there was an initiative called Kumbhathon. Now, Kumbhathon was the brainchild of Professor Ramesh Raskar, being a resident of Nashik for MIT Media Labs. And he, along with a few scientists and local people, local influencers in the city of Nashik, formed a not-for-profit organization called Kumbhathon in 2014. And they said, let's try and explore how can we use technology to try and reduce, if not completely eliminate, the problems that typically are seen at times of the Kumbh Mela, right? So they started with saying that let's crowdsource this whole thing. We all know there are problems, but let's start, crowdsourcing. So they launched a Google Doc basically, and they just asked everybody in the city, administration, students, citizens, just start writing out what are the problems that you typically face when Kumbh Mela happens in your city. And there were thousands and thousands of problems. Many of them were quite similar. For example, healthcare facilities, lack of information, so on and so forth. And what happened was that there was a pool of mentors that was formed. These were experts from across India and US. And this pool of mentors, where I was also part of that, worked with the local administration to identify problems worth solving. So while there are thousands of problems, let's focus on, we need to prioritize. So let's identify problems worth solving, which can have significant impact if they were addressed. Not only that, once we kind of narrowed it down to a set of tangible problems worth solving, it was then again crowdsourced out, saying, guys, if you have any solutions, any ideas on how to solve this, you can submit your ideas on this platform. And of course, there was a lot of push for youngsters. Unfortunately, till 2000, prior to this, the Kumbh Mela, because it's a major event, it lasts almost for a month and a half. In the city of Nashik, it is holidays, right? So the entire month is everything is closed. Colleges are closed, schools are closed. And youngsters, unfortunately, used to go out of the city. They would go on vacations, they would plan their own trip somewhere else, right? And it was like, in some ways, a brain drain, which is what this initiative wanted to also address. So they started roping in youngsters, saying, you guys are the future of this country, you guys are the future of the city, you must participate and try and solve some of these problems. So they went out to colleges, we had a lot of outreach programs, and thousands of people registered, saying that we would want to try and solve this. So there was an interview process, there was a process to look at the skills, and then crack teams were formed, okay? And over a period of about a year, starting from January 2014 through April of 2015, there were about 5 or 6 hackathon iterations. And in each iteration, we would refine the problems, we would refine the solutions. And at every stage, the administration, the local administration was involved, right? So they co-created solutions, they gave practical challenges that teams might face if they were trying to solve some of these issues. Because I think most of the thinking for youngsters, a lot of us actually, is a very lab-oriented thinking, right? So I will build an app, I will build a platform, I'll build some kind of a hardware prototype, but it's all very lab mindset. I want to use the best technology that I know, but not necessarily the best technology, the best way to implement it in the real world so that it starts making an impact. And this is the bridge that Kumbhathon wanted to kind of, create basically. What happened was, at that point of time, towards the end of 2014, there were quite a few innovative solutions that came up, okay, close to around 20, 25 ideas that were kind of shortlisted by the experts. But unfortunately, these were still prototypes because they were built by students. They had the right ideas, but they didn't know how to scale it, right? So it's one thing to build an app, right, and demonstrate how somebody could use it for 10 people. But imagine if the expectation was to have 10 million people use your app or 1 million people to use your app. You need to understand how to scale your technology. And this is where MIT Kumbhathon reached out to a lot of IT giants, including TCS, where I work, and said, could you bring your significant scale mindset and scale understanding of architectures, for example, technology architectures? Could you bring those expertise into this setup? And could you help convert these prototypes, which are designed from a lab mindset, to something that can be deployed at scale? And that is where I kind of actively got involved. one of the products that TCS had built was given for free for this setup, and I kind of got engaged in that, and that's how my journey into this whole social innovation actually started. And as you can see, once this Kumbh Mela was launched, or Kumbh Mela started in the month of August, there were 13 projects that actually went live. So there were healthcare, logistics, information gap, crowd management. I mean, this is all significant issues. And for the first time, there was the use of technology, not only high technology, not only high tech, which is basically prediction algorithms and machine learning and all those things, but even low tech, as simple as creating a social media channel, creating IVR systems for people to get access to information, creating wiki pages. A lot of these things started to roll out. So what was the impact of this, right? So all of these kind of happened over a period of about a year and a half. And if you could look at some of the stats here, right? This was the first time that technology was used to create impact at scale. We used crowdsourcing to find solutions. The participation of government became extremely important, because whenever you are trying to create impact at scale, you need ecosystem development and ecosystem participation. So in India especially, you cannot deploy solutions and create impact at scale if you do not have a buy-in from the government itself, because they are the largest entity with reach in every nook and cranny of our country. So if you want to create scale, you can create impact at scale, you must work closely with them. You should not treat them as system. You should engage with the system and try and enroll them into the innovation that you're trying to make. And when we look at some of the things that we were able to achieve, it was phenomenal. It was phenomenal, right? And maybe if there is a time at some later point of time, I could walk you through some of these innovations that were deployed. But there were a lot of firsts for this event. For the first time, there was zero loss of life, no lives lost. There were 30 million people. It was kind of accepted that lives will be lost either through illness or through stampedes or through mismanagement. This is the first time that there was zero loss of lives. Another kind of very common use case scenario is lost and found. There are tons of people, millions of people pouring in, and people get lost. Children are separated from their parents, never to meet them again. Parents, old parents, aged parents are separated from their young ones, from their children, never to meet them again. Some of them end up in destitute, some of them end up in orphanages. It is terrible in that context. However, this was the first time that there were zero cases of people who were lost but not found, right? So the entire thing was managed beautifully. There were many firsts like this. Epidemics, there was no outbreak of epidemics. There were 2 outbreaks that were caught 2 weeks into that journey. Usually epidemics were caught after they had occurred, and by the time it's too late. As we are seeing in the pandemic right now, if we are able to identify the outbreak even a couple of weeks later than what it's supposed to be, it has a multiplier effect, right? So there are a lot of positive impact that happen. And all of this, the use of technology to create social innovation, the engagement with government and convincing them of the potential of technology to create impact, working with youngsters, right? And mentoring them and guiding them, right? Because they have the right enthusiasm, they have the right mindset. It's just that there's nobody to mentor them or guide them in terms of how they can actually contribute. And fourth is the engagement of corporates and bringing in their expertise to create solutions at scale. Now, these 4 key things were something that we achieved. And these 4 things form the core pillars of Digital Impact Square.
Hello.
So we launched.
वीडियो कॉल सुन कह रहे हाँ नहीं मैं टॉयलेट में गया था अच्छा भाई बाकी ठीक क्यों दे बात अच्छा हाँ नॉइस क्या बात अच्छा से एक्चुअली टाइम वक्त शुरू कर चलो ठीक चलो बे दिनीशा ठीक
Hey, Manish, can you mute? Yeah,
go ahead. Yeah.
Apologies for the.
So, Samir, sorry to bother you. So we have a couple of guests here. One of them, he's a very famous neonatologist in United Kingdom. He's a subject matter expert and he's helping the frontline workers. And I think we have another student here. So I'm sure there'll be more people dropping in. So go ahead. You were talking about.
Right. So I was talking about these 4 pillars that we kind of looked at. We looked at how to engage with the government, how to identify problems worth solving, how to work with young people and mentor them and guide them, and how to bring the management and technical expertise of large organizations um, to bridge the gap from prototype to product, right, essentially. And this is what we have been doing at Digital Impact Square. Every year we take between 8 to 10 wicked problems across major themes: health, education, personal security, for example, housing and transportation, 7 broad themes. And we take 8 to 10 challenges every year. We bring young people who want to solve these problems, and we mentor them for a period of 18 months to 2 years. And some of them have become successful startups, social startups, and have started creating impact. Right. So this is our core learning from that experience that we had working on the Kumbh Mela and deploying innovations at scale using technology. So what's the relevance, right, in this case? Now let's look at what's happening, right? So we have about 11 startups that have been successfully incubated at Digital Impact Square, and they've all gone out, and we are in regular touch with them. We also have a lot of partners who are also incubators, and we
Please mute yourself, Geeta. Please mute yourself. Yeah. Okay. Thank you.
So what we've learned is and it is not surprising. I think if you are working in the startup space, I mean, this is something that's impacting large organizations as well. But I think startups have bore the brunt of this pandemic pretty bad, right? So some very significant impact that's kind of happening on the social startup spaces. Cash flows are severely impacted. So I mean, I don't need to explain this, but obviously this pandemic and the lockdown that happened kind of stopped the cash flow of the customers, and in turn, obviously, of the startups. Customer priorities change. So when they started their journey, and you'd have signed some contracts, you would have signed some procurement contracts from a lot of the customers. And remember, these are social startups, so they would typically be working with governments, non-government entities, CSR organizations of large organizations, and of course B2C, or basically customers who have some kind of a social challenge that they are trying to address, maybe let's say disabilities, persons with disabilities. Now, because of this pandemic and because of the lockdown and because of this crisis, the customer priorities completely changed, right? So they started looking at something else. Some of the solutions that the startups are working on were not deemed necessary to deal with the crisis that they themselves were facing. Access to ecosystems were significantly curtailed. I could not go out and talk to people. We could not go out and, I mean, the startups could not go out and pitch their ideas. They could not go and meet potential users. And there's only so much you could do on a digital setup, especially in the social sector where your communities may not even be digitally connected, right? So if you're working in a rural setup, the ability to reach out to the rural communities, travel there, meet them in person, a lot of those things were significantly curtailed. And another thing that's probably not very well highlighted is this attrition rate. So startups who had just begun their journey and they probably have their first 10 employees, 15 employees, many of them young people, they started seeing a lot of attrition rate, right? So as employees then, wanted to go to more predictable jobs and salaries, right? Because suddenly many of the startups were struggling just to pay their employees. So I think a lot more, but these were some of the key things that we started hearing about. But what's very heartening is none of the startups actually shut down. None of them gave up, right? And essentially, it's the core DNA of a startup. You need to be persistent. You need to spot opportunities. That's the reason why you're a startup. If you have a problem, if you have a crisis, as I mentioned right at the beginning of this presentation, what Albert Einstein says, a crisis provides for opportunities. And we're very proud that many of our startups spotted those opportunities and pivoted or started introducing new products and new offerings that kind of addressed what the startups, what the community was looking for, right? So let's look at needs, right? So when the pandemic started and there was a lockdown, these were some of the needs that kind of overnight kind of just blew up. Ventilators, we all know the struggle for getting ventilators, right? And if you look back, at what happened last year, we're talking of February, March timeframe, the information that we had about this virus was quite limited. A lot of it was still being researched. There were a lot of rumors flying around. There were a lot of kind of incomplete research observations that were being published, and there was a lot of panic in the community. So ventilators, obviously, what was deemed as a critical care, device suddenly became mainstream. Everybody wanted ventilators. PPE kits and masks were required. There was a very strong need for information about hospital beds and oxygen. Where are the medicines? Where are the isolation centers? I'm quarantined at home. I'm not allowed to get my cook to my home because everything is shut down. My maids are not coming. I can't cook. I'm bedridden. I don't have the ability to cook my own food. Where can I get food providers? A lot more. So I think so. This whole information shortage, everybody is struggling to figure out where to get this information. A rapid screening and testing of a large number of people. So obviously, the most obvious was those temperature guns, but there was a need, a very, very critical need to look at mechanisms to do rapid screening or testing of large number of people very quickly. Mechanisms to enforce social distancing and good practices. So how do you kind of create that? Supply chain management completely disrupted. One thing that we kind of realized is the disruption of special education. So persons with disabilities who need therapies and had to visit these therapy centers suddenly found themselves stranded. Right, everything was closed. They could not travel, and we all know how difficult it is to give online therapies. And there were a lot more. And if you go back and look at all these startups, and many of them became successful, they looked at this as an opportunity to do something meaningful in each of these areas. So there were a lot of organizations that started creating ventilators. Right, obviously it is still a prototype, and the journey from a prototype ventilator to actually making it useful or usable in a real world scenario where in a matter of life and death is a big gap. But there are a lot of people who started attempting to start, creating their own ventilators cheap. And a lot of this is very expensive, right? PPE kits and masks. So for example, we had one of our partners whose startup was using, they were creating recycled plastic, and they were creating products from recycled plastic, recycled clothes. So they would take all these old clothes and convert them into, new clothes. They started quickly pivoted out. They knew masks were needed. So they kind of trained all their people to start creating masks. They understood the specifications. They looked at the sizes, and suddenly organizations that were working on recycling plastic focused on creating sanitizer bottles, for example, because that's what the need was, right? So they kind of quickly figured out their adjacencies. They figured out what they were good at, and they started creating those products, quickly changing their core product and service offerings to address what was the need, right? And this kind of helped them stay afloat and at the same time create a very positive impact. Right? So let's look at some of the examples that we at Digital Impact Square. It's called DISC, D-I-S-Q, which is basically an acronym for Digital Impact Square. So I'll quickly walk through some of the examples of our startups and what they did, right? So we have a startup called Third Eye. They're working with the police department. And as you may be aware, there was a sudden lockdown in 2020, March. However, one of the key areas was, while the entire transportation, including trains, right, were completely stopped at a national level, there was still the need for transportation of essential goods. We're talking of food, we're talking of vegetables, we're talking of medicines, we're talking of medical, devices, and so on and so forth. These could not be disrupted. And there was very limited way at that point of time to figure out how do you ensure that all the transportation for these essential goods continues and non-essential goods and non-essential items are stopped. So we had, interestingly, this startup Third Eye, and they had a solution to register auto rickshaws, right? So for those who are not familiar with auto rickshaws, for the international audience, they're called tuk-tuks, so you may be familiar with that. So for the Nashik Police Department, Traffic Police Department, they had created a very simple platform to register auto rickshaws with barcode. So they would take in basic information, they would create a barcode. The barcode would be given to the auto rickshaw driver, and they would have to stick the barcode so that if a traveler was not happy with the services provided by the driver, they could actually scan the barcode, get details, and file a complaint to the police. Right? What they did was they took the solution, they identified that this was a challenge. They repurposed the solution in less than 2 days, 48 hours. They created an e-pass system, right? So they created a form, you could get the form, you could do some background check to make sure that they're genuine applications. And the system went live in just 2 days. And in a matter of just 1 month, more than 7 million e-passes were issued by the state government. So here is an example where a startup identified a problem. They came up with a solution. They deployed the solution quickly because they already were working with the police department. Had this been an idea that came from a startup that was not working with the police department, just getting an entry and a listening of the commissioner of police is virtually impossible, because by then the police were significantly strained in terms of the support that they had to provide at the community level, right? So everything was, everything was high priority. So this is what the key difference was. Another startup, Trestle Labs, which is working to make print accessibility visual for the visually impaired. They realized that the government was issuing a lot of notifications. Every day there were new notifications. Something would be shut off, something would be started, some things would be allowed, something would stop, would not be allowed. And they realized that a lot of their visually impaired community with whom they were working were relying on others to inform them. They were relying on some WhatsApp forwards, where there was no way to kind of ensure the authenticity. So what they did was they created a small team, and they looked at all these government notifications, state government, national government. They started scanning these notifications and converting them into a format in multiple languages, so that the visually impaired community across India could also understand these notifications and be able to respond to it based on what the notification demanded. So it may not look great it may not look a very big impact, but for the people who are visually impaired, this was a significant value proposition for them. And this has earned this startup a loyalty of the user community for whom they are working at this point of time. We had another startup called Kidora. They're working for early screening of children with autism. Again, lockdown in March 2020, the therapy centers and special schools were all closed. Everything moved online. And there was a significant stress on parents and caregivers. I mean, they had no idea. Most of them would kind of just take their kids to these therapy centers, wait outside for an hour, couple of hours. They would not even know what's happening inside the therapy center, right? The therapist would come and they would take the kids back home. Now, suddenly, all of that onus fell on them, and there was significant stress. There were breakdowns in the family. The team, which was originally working on early screening of children with autism, identified this as an important need. And they built a home reinforcement therapy platform that connects parents and experts online. And it provides a mechanism to track child progress at home, right? So it created a channel of communication between parents and therapists. They created a mechanism because they were working in this space, because they worked closely with experts, because they understood the therapies and what children with autism and related cognitive disabilities need in terms of support. They were able to quickly create this offering, and it's kind of being piloted in 2 major institutes as we speak today. Another startup called Resonate, which is working with hearing impaired students, had identified the same problem. Hearing impaired children need a lot of reinforcement to understand and recall basic concepts, especially in maths and science. So they quickly figured out that we could build game-based digital platforms. So they created a game-based, they created interesting games. In fact, their beta is going live this week itself, and they're actually looking for people. So maybe I could connect you if you're interested in looking at what they're doing. But they came up with this idea of creating home reinforcement for children who are hearing impaired, and help them learn concepts of maths and science at home, along with the progress tracking for teachers and parents. So these are some examples of startups that we started with. They identified a problem, they identified a need actually, and they quickly pivoted or created adjacencies or adjacent offerings that is actually making an impact. So to re-paraphrase, since a lot of the questions that I keep getting asked is, what can startups do? So I've identified these basic tips or hacks, if you can call them that. I think the most important is to identify needs versus wants, right? So what happens is when you start figuring out what are the challenges and what is the user community that you want to help, it is important to identify what is it that they need versus what is it that they want. Now, the reason why you need to do this is because whenever there is a focus on the need, the wants are often deprioritized. So what I need now, I'm going to invest my money, my time and effort on addressing that need, rather than what I want, which may be optional, which may not be very important to me at this point of time. So if you keep on focusing on the wants, right? I want to be able to visit a mall. I want to be able to watch a movie. These are all wants. I wouldn't worry too much if those were not addressed. But I want oxygen cylinders. I want information on where the beds are. I want information on where are the isolation centers. These are my needs, right? And if I don't get them addressed, I'll figure out a way to address. And therefore, I would be more than willing to look at your solution or whatever you have to offer to me, and in that process, even pay for it, right? If it is value. The third point is build what is needed versus what we can do. So sometimes what happens is in our zeal to implement technology first, right? We don't spend a lot of time figuring out what is needed. Right? So one of the examples that I gave earlier was, this journey from prototype to product is very important. If you're not able to deploy your ideas or solutions on the field, the impact is next to zero. So what is needed versus what can we do? So when we say what can we do, we are saying explore the adjacencies to your core product. If you are a hardware company, if you are designing something that can mimic or can be used for creating medical devices, you understand specifications, you understand the tests that need to be done, you understand the certifications that you need, then and only then try to create a medical device or try to create a hardware that is going to be used as a medical device, right? Do not venture into something that you have no idea, because your prototype may work. You may even get thumbs up from a few users, but it will not see the light of the day because you will not be allowed to deploy that solution. Same goes for, if you're a software expert, if you are creating an app, you need to understand what are the needs of the user community and then design that app, right? So what are your core or product and offerings? As I gave example of the startups, for example, the startup working with the police identified that their core product and service offering could be repurposed for a solution that can be deployed in the pandemic, and they did that, and they were able to create an impact right away. Similarly, focus on your core competencies. Do not try and build something or create new competencies. More so, the reason why is because time is of essence in the current pandemic. If you're going to take 2 years to build a solution, it's too late already, right? So if you are focusing on what your core competencies are, you will be able to quickly deploy your solution in the user communities and create an impact. And the last, but not the least, is while you're ideating or prototyping on the solutions, do not ignore the ecosystem setup. If you're trying to create, we have come up with a lot of people who are saying, I've created this app where if you enter this information, it will give you all the beds. Great. Now, who has to put in that information? Oh, the hospitals have to put in those information. Okay, great. How many hospitals have you onboarded as part of your pilot? Forget deployment at scale. No, we are just hoping that somebody will, connect us with the hospital and they will like our solution. You already lost the plot. You have to co-create with your ecosystem. You have to develop your ecosystem. If you're trying to create something which provides information on hospitals, if you're not working with an organization that is already in that setup, maybe it's an NGO, maybe it's a group of hospitals, maybe it's the healthcare department of your local administration, you'll find it extremely difficult because everybody is in stress. Nobody has the time to sit with you, to understand what you're doing, to give their time and effort to what you're trying to do. So you must figure out a way of fitting into their busy schedules and delivering what they're looking for without having them do additional work. So you have to create an ecosystem setup in which your solution is likely to be deployed. And think scale. So do not think prototype, think scale, because nothing is going to work if you're just going to be able to manage just 10 users, 100 users. You must be able to design or at least architect your innovations in a way. For example, Vidya, you may be aware, but we have Makers Asylum. Vaibhav is doing a fantastic job. And last year they started with this task of creating more than 1 million masks, right? So they have their Makers Asylum. What they did was they figured out different mechanisms and then open sourced it. When it comes to manufacturing, when it comes to creating these kind of manufacturing related, it's best to open source. At that point of time, you need to have a distributed mechanism. The more the people are able to access your designs and repurpose them or use them to create their own, the bigger the impact in terms of your solution reaching the user community that needs it. So with this, I think I'll take a pause. I've been speaking nonstop for about half an hour, and I hope this has been relevant and useful to the context of what we're trying to do. But I think it's a good time to now, for me to take a pause, stop my sharing and take questions if there are any.
Sure. First of all, I just want to introduce Minesh. Would you like to, join in? Minesh, Professor Minesh Khashu, are you available to join us? Yes, you can turn on the camera. If you have any thoughts.
Hi, Vida. Hi. Yeah, thanks. Yeah, I joined a bit late, so I didn't.
Okay, he's.
Sorry, thanks. Yeah, no, I joined a bit late, but I did catch the last 15-20 minutes of Sameer's very, very useful sort of presentation. So I'm listening in at the moment. But one of the things, Sameer, I wanted to ask is you've showcased some really good examples. Have they been published or disseminated widely?
Yes. So I think at some point of time, unfortunately, we do have, not in my backyard syndrome. So what is happening is every entity or every organization wants to create their own innovation. So what we have is a lot of duplication that's happening. And on one hand, we should not complain because it's essentially trying to solve the problem. At the same time, you're not getting that reach or awareness, as you rightly said, in terms of other organizations or other governments, for example, state governments, knowing what's happening. But I think if you look at the current setup, a lot of the solutions that we spoke about, some of them have nothing to do with government, and those are kind of being launched and worked upon. But for the ones where the government is involved, the process is a bit more, I would say, protocol based. So there's limited, I would say, control in terms of how that is disseminated or actually implemented.
Great. Yeah. So
I understand the difficulties, Sameer. One of my thoughts is, in a way, the way to look at this is that dissemination of innovation is perhaps one of the most difficult parts of innovation, and is an innovation in itself, because so in a way that is the toughest nut to crack in a lot of ways.
That's true. Absolutely. And I think however, there are a lot of effort now, thanks to the whole Startup India movement that was launched in 2015. There are platforms that are available where a lot of this information is being disseminated. I think it's a matter, as you rightly said, is the journey from dissemination to actually adoption and saying this is something I would want to use, is the gap that needs to be closed. And I think it's getting there. But for example, I'll just give an example. Everybody worked with us in the Kumbh Mela. All the IAS officers, worked on that whole journey. When they moved to other parts of the country, they took these learnings and they are deploying those learnings wherever they've gone. So it's an iterative process. That culture of innovation is getting built, but not in the pace at which we would all like to see.
Yeah, I think Namrata here. Namrata, if you want to unmute yourself, you're also building a startup, and she's also part of the Kumbh ecosystem. She uses learnings of Spot, Probe, Launch, and Grow. Namrata, quickly, do you want to summarize what you're building? So Sameer is aware of it.
Yeah, sure. So I have been a part of RedX, and with RedX podcasts, we would actually my college was in R&D, and it's similar to a lot of population, a lot of people coming for Wari. I mean, not as big as Kumbh Mela, but yeah, Wari, we used to have, I mean, that's a small place, and we used to have these 7 days continuous Wari. And our colleges my college is in R&D itself. It's like not even 1 kilometer from the exact spot. And it was really frustrating for us students, because it was noise all the way, and there were hospitals, so we had various problems. And similar to Kumbh Mela, we just had this inspiration to Kumbh Mela that let's try to solve some problems with AI/ML, whatever possible from our side as students. So we took a lot of problems. Which I was working on was the noise pollution, which affected the patients, a lot of patients and hospitals in R&D. So we made a hardware, which if we just made a prototype of it when in the student phase at least. So if that hardware, we can attach it to the windows. These were small windows, like really small. just square of them, we can say 1 by 1 feet. And if we close those windows, then the patients would really suffocate. And if we do not close those windows, then the noise would make that patient to suffer, right? So that's why if this if this small hardware was to attached on the window, then the noise was cancelled. We used the noise cancellation techniques, and with that the noise was cancelled. Obviously, it wasn't cancelled 100%. At the start of the prototype, it was cancelled 35%. Using MATLAB and ML, we are even right now working on it and trying to improve that efficiency to cancel that thing.
Yeah.
So that was.
Yeah. So Namrata, what you're building now, you're building an app where you're sharing resources, and she's doing it with the Google developer community. So you can track the beds, you can track food, resources, everything. And apparently government has introduced some ban. Kindly mute yourself. Whoever joined in now, could you please mute yourself? Okay, thank you very much. So apparently there is some sort of a ban. The government is not allowing every post to go on social media. So people are scrambling for the authentic source. Where can I find the beds? How many casualties are there? So Namrata with the Google development group, actually it's Women in Tech group. Next week we'll interview their group also. So they're building an amazing solution. I really liked her. She's a product manager, and she kind of brought in that new angle to this whole cycle. Like Samir was saying, scale is very important, and they are actually thinking about scale of adoption as well. So we have Pratik on the call for a long time. Pratik, do you have any questions? Pratik Khanapurkar, I think you're logged in. So if you have any questions, please share. Also, Dhanraj Kodam, you just joined in. Do you have any questions? Please feel free to type, or you can unmute and ask question. So Samir, I have a lot of questions. I really have a lot of questions. First thing,
okay.
I want to go back to that slide where it says zero loss of lives. You said zero loss of lives. I want to use that slide and come back now, to this situation today. If I want to have zero loss of lives, what are all the needs and what are all the wants which people are having in startups? They can move towards needs. If I want to have zero loss of lives, what are all the things which need to be done? If we were to do that framework, so that startups can start grabbing the problems they can work on. What do you think? What is your
Yeah, so there's direct and indirect impact. I think what's happening is right now we are always exposed to the direct impact. So we're talking about ventilators and oxygen concentrators.
Right.
This is the direct impact, right? And people who unfortunately are not able to succumb to this disease in hospitals or at home or whatever it is. And that's essentially what we are hearing at this point of time. But there's also an indirect impact. Right? There's a psychological impact. We saw examples of, persons with disabilities struggling. There's a huge population of what we call underserved communities that are severely impacted. We have people who do not have access to basic healthcare, right? So I think that's essentially what we're trying to do. So when you're trying to address these gaps, the biggest gap right now is lack of information. People are just scrambling, lack of authentic information. There's a bunch of information. There's no mechanism at this point of time. For example, even after 1 week, I still get the same WhatsApps of somebody looking for an O positive plasma donor or an AB negative plasma donor. Right. Long after that person has been discharged, is back home and all of those things. And what happens is the signal to noise ratio, I think, is in some ways also, is also responsible for people losing lives.
Right.
So I think if there is a mechanism, and I don't know how, a lot of people are trying it. I think there's a lot of good resources, and Namrata is working on one, but we have a lot of good resources that are coming in. Just to give an example, 3 years back, we tried solving this problem on shortage of blood supply in a city.
Yeah.
Okay.
Yeah.
So we took it up as a wicked problem in Nashik, and we realized that there's wheels within wheels. Okay. So the blood supply is not just an altruistic setup; it's a business. That there are organizations there is a financial consideration. There is value in holding on to information.
Yeah.
Right. So if I hold on to the information, no amount of technology, no amount of awesome apps or all of those things are going to help. Because if I feel that by not sharing this information, I'm going to get some value, right? Whether it's financial or power or whatever it might be. So I think that's so a lot of it is behavior. So for startups especially, when you're trying to address problems, do not ignore the behavior of the ecosystem in which you're trying to introduce this problem, right? So a lot of needs are there, I think, and some of these are fairly obvious. Yeah, if I build PPE kits, if I build masks, I can partner with distributors and it will kind of be sold out and all of those things. They are fairly straightforward problems. They are more, I would say, entrepreneurial solutions rather than startup solutions, to be honest.
Yeah, this is important, the difference between being entrepreneurial and being a startup. If you're an entrepreneur, yes, you're not necessarily going to build a startup. You'll create a solution which is scalable, which is sustainable, and then once the problem vanishes, you also move on to something else. So being entrepreneurial is a mindset. And Minesh is saying information infrastructure inequalities. That is the framework which is we are operating in. And he's also saying entrepreneurship and startups are not just about a product or process. It is about the attitude, the way of being, thinking, and doing, and that comes to the fore when a disaster strikes. So great. Yes. These are great thoughts. I had one question, at this point, startup as a word doesn't make sense. We need people to be entrepreneurial, come and create solutions. We should just say solutions. And like, yes, you nailed it, there are wheels within wheels. You want to create something and then you want to make a business out of it. It's going to bring in a lot of delay elements. And they have military working in India right now. There's absolutely no place to create an elegant product, elegant deployment. We just go with what works and make it happen. So Samir, in that sense, I know you're helping a lot of startups at Digital Impact Square. You had an announcement to make about your recruiting startups who want to make impact in the nonprofit space. Do you want to talk about that? Is this a good time? I think there was an announcement on Digital Impact Square page. Do you want to talk about?
So what we do is, we already have quite a few exciting startups that have joined our cohort. So we usually start in the month of January. So we are about 3 months into our journey.
Right.
We would be looking at, because of this whole setup, what we're trying to do is rather than trying to look at startups, we're trying to mentor startups that are trying to create an impact at this point of time, right? So apart from our own cohorts, if there are startups out there that need some kind of guidance in terms of creating social impact, then we are partnering with organizations so for example, the Maharashtra State Innovation Society that I am a part of, there's a lot of hackathons that are happening to solve very pertinent problems, relevant problems, right? So by being part of those.
In this time, people are participating in hackathons, they are?
Yes, but because they are trying to hack into very pertinent needs right now, last mile transportation and all of those things, right?
What I realized was there's a huge body of youth who can't go to school. They are sitting at home. They have 2 hours class and they're bored, and they're very talented, and they are intellectually restless. Nobody's there to tell them what to do, and parents won't allow them to go out because of the lockdown. So so those are the people to take this up. Okay, great. And Namrata here is saying there are a lot of ideas I've heard from students and many community members, but there are health legal issues. Can you please help us with how can we go for an idea when it is in the health domain, not getting into legal issues? How can we pursue that?
Yeah, so there are 2 things around it. So in some cases, exceptions are being made. So in a crisis, even for example, if you look at the clinical trials that are happening for all the vaccines, the highest level FDA has given certain, I would say, leniency in terms of the way clinical trials are being done, right? So that's one side of the coin. So if you're doing something that is highly relevant, very, very pertinent, and is a need, I don't think there's going to be a lot of red tape that's going to block away, unless that red tape, if you want to call it that, can result in significant impact on lives, right? So if you're creating something that has a matter of life and death, then obviously it can't be taken lightly. The other thing that might help you is if you are working or planning to work in the health domain, what you should start, like what we did the Kumbh Mela and what we do now, is you need to first have a pool of experts with your setup, right? So before you reach out to people with ideas, reach out to experts who will help you evaluate and help identify which ideas will work, which ideas will not work, and why they would work and why they would not work.
Yeah.
Jumping directly into ideas without having an expert or a set of experts on in your setup, which is the ecosystem that I keep talking about, will mean that you will come up with ideas, but they will never be deployed in the real world. So it's best to co-create with experts.
Yeah.
Right. And there are a lot of experts, just as there are students waiting, right? There are experts with a lot of ideas. We have doctors who said, if you could do this,
Yes. Yes.
But I just don't know how to develop an app. I don't have engineering mindset. I don't have engineers who can help.
Yeah.
Can you connect those two dots? Can you connect those who have the expertise and understand what needs to be done with people who want to do something and have the skills, expertise versus skills, and bring them together? Then there is potential that you could create some form of impact quickly.
Namrata, go ahead. You were saying something. Go ahead.
Yeah. So I'm saying the same, that I think this is something I can convey to the community members as well.
She's connected with a community of innovators, so she will relay the information. That's what she's trying to say. And it was her question. So Minesh is asking, how are you assessing the capacity for stakeholder or community engagement and co-creation? How are you doing that?
So I think it's very difficult in the context of the stress that the stakeholders of the community is in at this point of time, which is where I think what we have been encouraging our startups to do is not to go into new areas. If you're already working with an ecosystem, if you're already in touch with experts, you have a certain credibility that you've built into that community or those experts, then you continue to tap into them. Don't try to create new entities which will take away a lot of your time and effort without any promise of a potential solution or any deployment of the solution, right? So that is first and foremost. And second, of course, by virtue of having worked in that community, you are, or at least when I say you, I mean as a startup or as an entrepreneur working in that space, you are conversant with what is possible and what is not possible in that context of where they are. For example, I'll just give an example, right? So a non-pandemic example, but let's say we're working with the farming community, right? We know for sure that from the month of June through September, they will not be available for any sort of experiments, okay? Because it is their harvesting season, they have to go farming and all that, right? Because that's their priority. And if I try to introduce too much complexities and innovations and ideas into that setup, they are going to reject it. But there are times during the rest of the year when they have more time, when they are more open. So I think it's a matter of being able to assess that. For example, right now, do not try and add more work to a doctor, right? Yeah. They are completely stressed. If you're coming up with an innovation which says, okay, you just have to give this 10 additional fields in this app and this information will magically be available to everybody else, I don't think you're going to get a lot of encouragement from the doctor community. Even though they know it's important, they said, I would rather look at patients and spend time with them than trying to fill out a form that you're putting in an app next to. Right? So you'll have to figure out and balance that.
Yeah. So Sameer, thank you, Minesh. Great question. I wanted to, let you know, I've been doing these webinars with the high school startup founders and also these desperate SOS groups. So some of the things which I heard from them last night was they need a COVID call center. COVID call center means somebody who's got a vaccination, they've gotten home. Nobody's telling them don't go out for the next 1 week because you still are vulnerable. And if you're above 50 or whatever, you will have higher chances of getting COVID. So somebody is to tell them stay home, or let's say somebody has gotten a shot and they don't have a shot, they're waiting for the shot, they're isolated. Nobody is there to talk to them, like really old people, no one's talking to them. And how are you doing? Do you need food? You don't necessarily have to knock at the door. You can just call them or text them. And what they said was, we are here in California. I'm here in California. Namrata is there, and you're in Nashik. We're in, some of them are in Mumbai and Bangalore. They're all on the call. UK. You can still call somebody in another part of the world and ask, how are you doing? So this is like a call center business, and they just have a couple of people moderating this. All you have to do is give your name and your phone number, and then give the slots where you want to pick up the phone and call. And they appreciate if you're a local language speaker, then somebody very old may not understand English, their local language, you can talk to them. So this is a COVID call center idea. Then here in the US and Texas, they're building applications where people want to donate and they want to donate, and everybody's asking for money. So which is the authentic source? And I'm from, let's say, Bangalore. I'm from Baswangudi. I want to donate only to Baswangudi. It's my home area. I was born there. So what kind of nonprofit is running there? Will I make sure that oxygen cylinders reach to Baswangudi, right? So they have an app for that. Regionally, it just pops up. In this area, they're raising money for this. So that's another app I thought they could use. But they're building here in Texas. These are students. Everything they were building yesterday, I was judging a pitch event. I thought, hey, this can be used in India right now. So what I'm saying is, there should be a way to connect these people quickly, not necessarily build a prototype. You just gain traction on your own outside this whole design thinking or startup community. You build a community engagement. I really like the COVID call center idea. I'd want to call as many people and comfort them and ask them whether they had a meal. And, if I have another number for food drop off, I'll just, because these people don't have energy to type or text or do anything literally, then I want to call them and connect them with a food, delivery service. So anyway, so great. I think it's very late in the night for Namrata and Sameer. I don't know how to thank you. Just seeing you there smiling, from India, and you're willing to help. You have so much energy. It just reassures me. This call was more for me that my family is doing well back home. I want to ensure that there are people to take care of them. So this is more for me, but also for a large community who's serving the COVID affected community. So Sameer, any last thoughts? What do you want to tell the startup founders other than all the advice you gave, and generally the citizens? What is it that they need to do? How do they need to scramble, and how do they need to survive? What is your strong message? What is your message of strength?
So, no, I don't know. I mean, we are all in this, right? So it would be a bit of a preachy kind of thing for me to tell. But I can tell you what we are trying to do is at the end of the day, we need to take responsibility of our own safety and well-being. I think there's too much reliance on somebody else doing it for us, and we kind of just waiting for others to take care of us. I think we need to be extremely careful. We need to have our own responsibility towards us and towards people around us. And I think it was, we saw this when they, towards the end of last year, when things were much better. A lot of the protocols were completely lost, and people just started going out and assuming that there would be a repetition. And I think that's we are learning that lesson a hard way. We all have to take our own responsibility and not wait for others to tell us. I mean, it's not very difficult. Protocols are quite simple: wear a mask, sanitize, maintain distance, avoid going out if you can. It's not rocket science. Unfortunately, it's come to this because probably we have been too casual in our own mind on how to respond to something like this. So hopefully, we'll all kind of that compliance mindset. Making sure that it's not just my own safety. I could be asymptomatic, and I could infect 10 others. And while I may be hale and hearty and not, and get by with just a sneeze and some fever, it could be a matter of life and death to somebody else around me. So I think that awareness and that responsibility needs to permeate a lot more deeper into the society.
Great. So so this is more social responsibility, Minish says, and as citizens, we all need to follow that. So great. Thank you, Sameer, and thank you, Namrata, for helping me coordinate this. I'm sure a lot of people were listening to this, and great questions there. And Sameer, incomparable moderation and guidelines, as always. We certainly will come back to you for more guidelines, and we hope Digital Impact Square and whatever initiative you're backing, it churns out really great startups. Thank you all for joining this amazing session. And we hope some of you got some useful information out of this. Please reach out to me or Sameer, Rawal, or Namrata for any further queries you may have. And with that, I'd like to wrap up this session. Thank you so much.
Thank you so much,
Yeah.
Vidya. And if there are who are listening in, if they reach out to you in terms of ideas or things that they want to do, and if they're struggling with some sort of, if they need some guidance, I'm available. So we could plan that as well on a separate.